I'm here to talk about the importance of exercise in the management of venous and lymphatic disease. My name is Natalie Phillips. I have a few conflicts of interest, so I've been open and honest and listed them. Caroline knows all my conflicts of interest. So I'm clinical manager at Hadnam Healthcare, and we have a standout in the main auditorium. Yes, so we are also Lead Club industry partners as well. I'm very proud to be industry partners. I've been involved with the Lead Club myself for about 11 years, so do see the valuable work it does. I'm also a clinical nurse specialist at Oxford Lymphedema Practice, which is a private practice that is mainly concerned with the surgical management of lymphedema, so it's microsurgery. And for those not suitable for microsurgery, we do liposuction as well. I'm a clinical director at Lymphatic Therapy Solutions, which is my own practice, where I see patients privately, and one of the senior trainers at the Lymphedema Training Academy, where we teach everything lymphedema. We are known as lymphomaniacs. We have a great team of us up there. So those are the conflicts of interest. So yes, today, very much, we're just going to look at exercise. We hear it batted around all the time. But why? We know it is essential for mental and physical well-being, but do we understand the physiological happenings, for want of a better word? This is, what are we on? Number 5? Do we really understand what it does, especially where our patients have venous and lymphatic diseases? So you're sort of grouped, so just take a minute to have a discussion in your groups about what you think the impact of exercise is on the body in terms of venous and lymphatic diseases as well. How?
With the pump, so like the calf pump and the toe pumps, even if you get them to just move their ankles, it's improving the flow of the lymphatic.
Sort of. We'll come back to it. Go on.
Stop wasn't doing much when building up, so if we're sat in the chairs, we've got more pressure on our vessels and on our lymphatic system. Whereas if we're moving, our natural kind of calf muscle pump helps to move everything back up again.
So more about venous return.
Yeah.
Okay.
We're saying as well as the pathophysiological effects of exercise, there's all the mental aspect, because you feel better when you exercise.
Yeah. And it's the endorphins. Definitely.
Yeah.
Definitely. Anything else? Social aspects? If you're going out for a walk, meeting people, swimming, classes. Yeah. So there's lots and lots that it can have a positive impact on the body, mentally and physically. But I think we underestimate how it can really help our venous and lymphatic system. So I'm going to talk through just a little bit to do with I'll just go back, the lymphatic connection and then the venous connection. The lymphatics are my thing. I love the lymphatics. There's a lady in the corner that will vouch for that as well. We've really got to understand that this system is a passive system, and without movement we don't get drainage. So the lymphatic system sits centre stage, she'll go back to the video, sits centre stage for the regulation of fluid within the tissues, and is often the forgotten part of the circulatory system. Everybody's very quick to talk about veins and arteries, but not much gets said about the lymphatics. When blood leaves the arteries at the capillary bed, well, not blood, proteins, molecules essential for cellular function, and we get waste products and fluid in the tissues, that fluid is returned to the system via your lymphatic system. So it travels with help from us through the initial lymphatic system into the deeper lymphatic system, where eventually it will reach one of between 600 and 800 lymph nodes, and it will pass through more than one. At this point you get a little bit of that fluid that is concentrated and returned to the venous system, and it's where our white blood cells are stored and made, and we fight infection and clear up the blood. As it goes into the deeper system, I'll just play that again, she says. As it goes into the deeper system, it is then taken into our major lymphatic vessels in the trunk. So deep in the abdominal cavity, running along the major vein, so running along the vena cava, and is basically put back into the circulation at the heart. And any of those waste products that are dumped back into the circulation are then taken and filtered through the kidneys, and we pee them out. So you'll see when a patient has bandaging and they have a lymphedema, that actually they'll say that they've been on the loo all night, and it's because we're reducing that edema, we're getting it to go, filter through the kidneys and go out to where it needs to be. Does that make sense? The lymphatics, the major lymphatic vessels run alongside the major veins, you'll see, and the lymphatic system itself starts just within the skin. So we've got these initial lymphatics, they're attached to the skin and the surrounding tissues by little guide ropes called anchoring filaments. When I move, those anchoring filaments pull on my initial lymphatics and encourage fluid from the tissue space or the extracellular matrix to be taken up by those lymphatics. It then moves down into a pre-collecting vessel and then a deeper collecting vessel, but only in response to me moving and filling those lymphatics. Your lymphatic system is really passive and just doesn't do anything unless we move. Minimal. So yes, we've got our circulatory system, and within the circulatory system we have got our circulating blood volume that remains pretty consistent, with bits being taken from it and bits being added to it. But once the blood has come down the arteries at high force into the capillaries, it's at that point then gaseous exchange takes place, proteins, molecules go out into the tissues to bathe our cells. We still have that circulating volume that remains, and it's just your deoxygenated blood that then goes back to the heart and lungs to be reoxygenated again. Nothing comes back into the venous system at that end. It comes back through your lymphatics, and the lymphatics then add to that system along the way. Does that make sense? So the lymphatics are really, really important. So where does it go wrong? So the development of lymphedema, I'll talk about lymphedema first because that's my thing. If we've got a lymphatic problem, that obviously patients can be born with it. A lot of what we see is that patients have undergone treatment for cancer, where they've either had a lymph node removed or the lymphatic system's been damaged through surgery or radiotherapy. What happens is we get that blockage, the lymph that's in that lymphatic collecting vessel backs up into the tissues, and we've got a swelling. And it's looking for somewhere to drain to the path of least resistance. What we see in primary care a lot of the time is that we've got lymphedema secondary to obesity. So you think about those initial lymphatics and how the fat can stop those initial lymphatics from taking in fluid. We end up with edema. We've got those patients that have got an underlying venous condition, and that venous condition means that they've got fluid leaking out into the tissues because the veins aren't working properly. We get a swelling when the lymphatic system becomes overwhelmed and can't move that fluid. So when you think about the stages of venous disease, the classifications, that actually we go from no swelling to swelling all of a sudden, that's the lymphatic system isn't coping. So we have to work with both. The slightest movement can influence tissue pressure. So part of my role within education at the Lymphedema Training Academy, we also have that there's a clinic there called Lymph where they map patients, and we map our lymphedema patients to see what the function of their lymphatics is like, where they're draining to. It allows us to individualise care. Now these are my lymphatics, and I just wanted to show you just how the slightest bit of tissue movement can push fluid through the lymphatics. So it's a passive system. Those collecting vessels have valves. Those valves only contract and push fluid along in response to being filled. So we have to get the fluid from the tissues into the lymphatics through movement. The more that they're filled, the more they stretch and then reach capacity, contract, and we'll push it along to the next lymphangia and move it along that lymphatic system. But just the slightest bit of movement. You'll see here in the next video, there we go, that actually the professor's filling my lymphatics there, and you can see that they become more fluorescent the more he pushes on the tissues, and then actually clears my lymphatics to move that fluid along. So movement really helps the lymphatic system. But it also helps the veins as well, and I've got this booper video here that's going to take you through the problems with the veins, just so I
The
can
deep veins pass through the deep tissues of the legs. They transport blood from the legs and feet back up towards the heart. The superficial and deep veins are connected by perforator veins. Here we show the position of the deep veins, superficial veins, and perforator veins in the leg. The deep veins run between the muscles of the legs. Contractions of these muscles
See the muscle
move your legs and
contraction?
ankles, help to squeeze the blood back up towards your heart. Veins also have valves that prevent the blood from flowing back towards your feet. Here we show a valve and the muscles around the vein. Varicose veins are thought to develop when the valves don't close properly. Here we show a valve in a superficial leg vein. If the valves don't work properly, the blood is able to flow backwards. Blood pools in the vein, causing the vein to stretch. This is called a varicose vein. Here we show a vein that has become varicose. Here we show a varicose vein in the lower leg. Varicose veins may cause symptoms.
So you can see, we get that leakage of backflow of blood through the veins, it leaks out into the tissues, we get problems then with hemosiderin staining in skin tissues, problems with the skin in the lower legs. And if we've got that fluid component, it's because the lymphatics are struggling to take it away. The other thing we've got to be really aware of is the endothelial glycocoalax. Now this is something that was is talked about in I think it's a 2010 article, but we're all very much aware of now. And it is the glycocoalax that is responsible for maintaining the function of a healthy wall of a vessel, so an arterial vessel wall. If this is functioning properly, it will stop proteins and water leaking out of the vessels too much. It's a protein that is really essential for that, and it responds to the shearing forces of blood going across it. So the more we're moving, the more we're increasing blood flow, and the more we're stimulating a healthy glycocoalax layer. If we're sitting with our legs dependent and doing nothing and not moving and eating lots of unhealthy things, this gets damaged, and then we end up with more filtration across the vessel wall. So there's other things that can affect filtration across vessel walls, isn't there, like medications and problems with protein and things like that. So it's something that we just need to be aware of. So it's saying to patients, okay, it's good for your arteries, It's good for your lymphatic system. It's good for your veins. It's good for your mental health. And relabeling it more like movement as opposed to exercise. Because exercise to me is like the word diet.
Is that reversible? That if you've got a patient starting and you said, right, do this, is that reversible?
Yeah, because it regenerates.
Yeah.
So it's a protein based thing, it will regenerate. We've seen it before where people that talk about eating carb-loaded meals. Carb-loaded meals damages the glycokylax, and so does alcohol. So, and I've seen it where you get a little bit tipsy and then the next day you wake up a bit hungover and a bit swollen because your glycokylax is struggling, you've got more filtration. So yeah, it's reversible. The implications of lack of movement we've all seen in clinical practice. We've seen those legs that have got dependency edema, that have got poor skin as a result of fluid sat in the tissues. We've got swelling wounds if there's venous insufficiency as an underlying factor. Red legs, so bilateral red legs due to the increasing pressure in the tissues. Again, causing that those skin changes. The less the patient's moving, the more likely they are to have joint problems. Joints become stiff, and weight gain, which again puts a pressure, on the both the body in general. So, what can we do? There's lots of different types of exercise. How many of you prescribe exercise or document it in your care plans?
Yeah.
Yeah. It has to be part of the plan of care. Movement and drainage. Lots of different types. Obviously there's active and passive exercise. So passive involves no voluntary muscle contraction, whereas active does. There's isometric exercise. There's different things you can do, from swimming to Pilates to yoga, to weight training, to strength training, and it can be done either seated or lying, or it can. I think the point is that movement can be tailored to any individual, and it's something that we must do. I'm going to play a little video now, and this video is from one of the lymphedema therapists down in London who's done this for Cancer Research UK. And it's very much
You can use your arms.
seated exercises, but she does do standing as well. This is available on the Cancer Research website.
Standing and bending the knees.
But there's lots of videos out there to show.
With pain, you can do it a bit lower. Next one, we'll be focusing on the ankle, and we'll do heel, up and down as much as possible, up and slowly going down to the floor. Next one will be toes up. And to finish, we'll do a bit of ankle. This one you can do sitting down on a recliner chair or on the bed. And what you'll do is going up and down as much as possible. And you'll do one leg and then the other, or if you are on the bed or on the recliner chair, you can do it both at the same time. And then we'll do circles, and as much as possible looking for all the positions of the foot, one direction and then the other.
Yeah, I said that we should all be sat doing that now. We are.
Speak to your doctor or your lymphedema specialist, and remember you have more information about lymphedema on the Cancer Research UK website.
So there's lots of videos out there that can be used, and leaflets. Obviously the Leg Club have leaflets. there's Legs Matter campaign, British Lymphology Society as well. You've all got the exercise leaflet that's been produced from them as well. So what can we do? I think for us what we have to remember is that we need to treat all underlying causes of any wounds and lymphatic disease. So I was thinking about, okay, is there anything that I can reverse? But remember that lack of movement is a key contributor. We have to tailor the exercise or movements to the individual capabilities, and remember that the best kind of exercise is one that the patient can do, not one that we expect them to do. You've got the BLS exercise sheets, a few things that we will use in clinical practice, and we use a lot of our lymph drainage balls. So we get these from the Lymphedema Training Academy. We will teach all our patients as part of their self-treatment to empty their lymph nodes, but to do that whilst moving, it promotes movement of joints. So for leg swelling, you've got your popliteal lymph nodes and your inguinal lymph nodes. We will get patients to just pop the ball in at the back of the popliteal region and just bend 4 times. But that's getting them doing some movement. Again, if they're on the bed, they can get this one into the inguinal region, come up and across. And again, that is really good for movement and drainage of emptying those. So those you can, they can purchase them. The other thing as well is if the patient's sat, there is a deeper drainage pathway that goes from the centre of the foot up the leg. Pop the ball on the floor, and as they're sat, they can do it with a tennis ball as well. Just getting them to roll the ball underneath their foot. That helps with movement and drainage. It's just little things really. Swimming is a great exercise for patients if they can get there, because it's compression. And it's a compression that you can give a patient without a Doppler. So it is, there's chair-based exercises, there's just so much. And again, it's that if we're doing it as part of leg clubs, getting that exercise into the clubs, group exercise, it might actually promote that health and well-being with those patients. Okay, we've got case studies now.